It's always difficult to give bad news to a patient, so it's helpful to have a strategy in place that will make that situation a little bit easier. By putting the patient at ease, you're going to be more at ease yourself as well. And that really lends itself to you having more satisfaction with your job and being satisfied with how you were able to relate with that patient. You're helping the patient through a difficult process, and having a good strategy in place to make that easier for them is really important. Spikes is a mnemonic that stands for multiple things that will help you set up a good interaction with your patient. S stands for setting, which involves making sure you have a quiet location for your patient, making sure there are no distractions that will come up during the interview. You want to make sure you're at eye level with your patient as well, and make sure that the interaction feels comfortable to them. P stands for patient perspective. This has to do with making sure that you understand where the patient is coming from on that day. You want to be sure to ask them what they think they're in to talk to you about that day. I stands for invitation for information. This can come up during the interview when you deliver that bad news. Oftentimes that's about as much as that patient can handle. You really want to make sure that you ask them, are you ready to hear more, perhaps about the treatment or the finer details of the diagnosis, or if that's something that they'd rather wait until another interview to talk about. K stands for knowledge. This means that you should talk to your patient at their level of knowledge, understanding that patients don't have all of the medical knowledge that you have, so you want to make sure that you use words that they understand. E stands for explore emotions and empathize. This is really one of the most critical things that you need to do as a clinician when you're having a conversation like this where you're expressing some bad news. It's important to be aware of both their nonverbal and verbal communication of their emotions. Be sure to look at how they are acting in response. Do they lose eye contact? Are they crying? It's also helpful to directly ask your patient, how do you feel about this news that I just told you? Okay. S stands for summarize. Summarizing the conversation is important to make sure that your patient walks away with a good understanding of what you told them that day. Simply asking them, what do you know about your diagnosis, or what have I told you about your diagnosis today, helps them say it back to you and helps you understand or know that they understand what you told them.